Hello there again. This is Dr. Stan Owen from Ask Dr. Owen on drdiet.com, and I'll be answering questions any that you have regarding your health, your nutrition, or weight-related illness. I had an interesting question from a patient. Let's just call her Edie Estrogen. And Edie had a question for me. She said, "Dear Dr. Owen, I take estrogen. I'm very concerned that it's going to cause weight gain. I've heard both conflicting stories that it can cause weight gain or weight loss. What's your opinion, and how do you treat patients?" Well, Edie, this is a very easy question for me to answer because I've had a huge amount of experience over many, many years. I'll start with the first very simple premise. What happens when you spay or neuter any mammal? Dog, cat, horse, doesn't make any difference. Well, they gain weight, right? And where do they gain weight? They gain weight suddenly, too. And where do they gain weight? They gain weight in their trunk. They look like little ticks walking around. You can almost look at any animal and tell, yes, that animal's been spayed or neutered. Well, humans are no different. We're a mammal. And you spay or neuter us either artificially with surgery by hysterectomy and taking the ovaries out, or naturally with menopause. And as the hormone deficiency increases, the weight increases. Most postmenopausal women gain weight, especially in their belly. And this is a common phenomenon. Now, we're not really known exactly how this is done. We know that hormone deficiency causes a 6 to 9 pound weight gain, primarily in the trunk per year. And often it also causes a slowing or kind of a mellowing of behavior. So what happens when you have a rambunctious dog? Boom, you spay or neuter them and they calm right down, right? Do you want to be calm? I don't think so. Well, there was a great article. This was in Obesity Research. This is March 2010. For those of you interested, this is on page 470, and this is from Sweden, from Umeå University. And what they showed was that estrogen reduces 17-beta-hydroxysteroid dehydrogenase in the liver and the visceral fat. Now, what this means is, fancy words, but what this means is that estrogen prevents the conversion of cortisone from its inactive or lowly active to its very active product. And if you've ever seen anybody that's been treated with cortisone, they gain weight, their face gets round and puffy, they swell up all over, especially in their trunk, they have breakdown of collagen, they get stretch marks, they have little bruises all over the skin because the collagen is breaking down in the skin, and they gain weight and get osteoporosis. This has been known around for 100 years, since hysterectomy started becoming commonplace. We just didn't know exactly how it caused this problem. And if you know the other effects of cortisone, none of them are good. And so I've been using hormone replacement for years. I use natural human estrogen. I use something called estradiol, a 17-beta estradiol. You can get it with a prescription at the pharmacy, $4. The key is you place it under your tongue, 1 or 2 milligrams, especially at bedtime. It helps you sleep better, gets rid of the hot flashes, helps you think more clearly, improves the anxiety, improves your libido some, and it is quite effective. I see some improvement in weight. You still have to diet the weight down, but if you want a girly figure, you're going to have to take girly hormones, and that's basically it. There's controversy because of one study using horse estrogen that showed higher risk of heart attack and stroke. So what I do is I take a little ultrasound device and I scan the arteries to see if there's any plaque. It tells me if there's a risk of stroke. And I certainly make sure that the patient is doing monthly self-exams for lumps and gets an annual mammogram. And I think the risk of a complication of that is very low. You'll know the difference in a month if it's going to help you. Vaginal dryness goes away, hot flashes goes away, sleep gets better, thinking gets better, libido gets better. It's easy to measure. So if you have any questions more about this, just email me. You can go to drdiet.com, drdiet.com, and I'll be happy to try and answer your question as best I can. And keep posted. Give me your questions. We'll cover them almost as daily if we can. And I'll be sharing the current literature with you pertinent to your topics every single day. I'll see you next time. Bye.